O grupo OnyxCan é pioneiro quando o assunto é cannabis medicinal, transformando ciência em saúde. No Brasil, somos os únicos a trazer uma linha completa de produtos de cannabis medicinal, incluindo produtos com maior teor de THC no padrão Farma de produção. Nossa missão? Melhorar a saúde e qualidade de vida. Nossa visão? Revolucionar a forma de tratamento e o sistema de saúde do brasileiro. Nossos valores? Comprometimento com a saúde com transparência, de forma responsável para garantir segurança e bem-estar. A OnyxCan conta com 4 pilares estratégicos que garantem a eficiência do tratamento canabinoide. São eles: educação para o médico que busca aprofundar seus conhecimentos de forma científica e para o paciente que busca informação para um tratamento seguro de cannabis medicinal. Inovação e tecnologia digital para o acesso do paciente ao tratamento médico. Farmacêutica com uma linha completa de produtos de cannabis medicinal, tendo uma linha própria de produtos. A Tegra usa Line, a Tegra Euroline e a Tegra Nanoline. E ainda possui acordos internacionais exclusivos com a MGC Pharma e Citec para importação de produtos, incluindo pesquisas científicas e registros de produtos fitoterápicos e naturais, com tecnologia farma de ponta, dentre eles com a parceria da MGC Pharma para 7 produtos oncológicos e 1 para Covid. E na divulgação de notícias, casos de pacientes e pesquisas, por meio da maior fonte de informação da medicina canabinoide brasileira, o portal de notícias Cannabis e Saúde, incluindo o Medical Cannabis Summit, o maior e melhor evento de cannabis medicinal do Brasil. Se o assunto é cannabis medicinal, o grupo OnyxCan oferece o que há de melhor e mais moderno, incluindo informação, educação, tecnologia e saúde, com transparência, segurança e responsabilidade.
Olá, sejam muito bem-vindos à terceira edição do Medical Cannabis Summit. Eu sou Igor Lopes, estou aqui com vocês em alguns desses conteúdos e agora apresento meus dois colegas que estão aqui comigo quase todos os dias nesses eventos. Para começar, o Marcos Bruno, editor-chefe do portal Cannabis e Saúde. Obrigado mais uma vez por estar aqui conosco, Marcos.
Olá, Igor. Prazer estar aqui mais uma tarde agradável aí com conteúdo de alto nível. Olá, Jaime, meu parceiro aí já de entrevistas. And hi, Mr. Michele, it's a great pleasure to be here with you this afternoon.
Também estamos aqui com o Jaime Ozzi, que é sócio e VP de negócios da OnyxCan. Jaime, de novo, obrigado mais uma vez por estar aqui conosco.
Igor, muito obrigado. Marcos, companheiro de jornada. Doutora Michele Rilo, thank you very much for coming. Toda a nossa audiência, eu agradeço muito a presença de vocês e vamos por mais uma palestra, mais conhecimento para todos, que é muito bom poder compartilhar isso com vocês. Muito obrigado pela presença de todos.
Com certeza. Vamos apresentar a nossa convidada, então, é a Michele Rilo. Ela é diretora de Educação Clínica da Cannabis Academy. Ela tem mais de 30 anos aí de experiência clínica, de pesquisa na área, incluindo o uso de canabinoides médicos no tratamento da dor, distúrbios imunológicos e sequelas de doenças infecciosas. Thanks a lot for being here with us, Michele.
Thank you.
All right, so I hear you have a presentation for us, right?
Yes, our first presentation is going to discuss traumatic brain injury and cannabinoids. So when you're ready, we can proceed.
Yeah.
And thank you so much for allowing me to discuss this.
Good.
I'd like to introduce the first slide, introduce the concept of using cannabinoids and management of traumatic brain injury. We first published this paper in 2020 after evaluating the effectiveness in recovery among players and in American football, individuals who had sustained various types of traumatic brain injury. Next slide, please. The endocannabinoid system is an array of receptors that permeates the human body. CB1 and CB2 receptors are found throughout the entire human physiology. These are incredibly important for the basic function of every physiological aspect of our being. What's important in traumatic brain injury is CB1 and CB2 receptor placements, how we respond for inflammation, and how we respond to recovery phase using phytocannabinoids. Next slide, please. The endocannabinoid system is complicated, but as you an analogy of using the intricacy of an automobile, without the endocannabinoid system, every aspect would not function properly. For example, you cannot turn on your automobile if you do not have basic circuitry. These receptor sites govern how we respond to injury. In traumatic brain injury, where the head is directly impacted either by an inanimate object, such as the ball, by a human being, such as in a collision in soccer, or a hard surface, such as a floor, or indirectly, as in rebounding in the game of basketball, where the impact of the floor sends a vast array of impulses to the back of the head. The endocannabinoid system responds by producing various macrophages and releasing the governing signals of mast cells to direct the immune function, the immune system, to respond to the damaged area. Next. These synapses are easily disrupted. Now, between masking pain in the treatment of head injury, which is something would be untoward, given the fact that individuals often suffer the symptomatology of loss of consciousness, foggy thinking. We certainly don't want to mask aspects, but what's different in these as they are disrupted is that we can replace the cannabinoids. Now, in this country, in the United States, there's an enormous amount of research, as there is all over the world, on using cannabinoids to restore the disrupted system, as opposed to masking the symptomatology that is accompanying inflammatory processes that occur with traumatic brain injury. Next slide, please. One of the common injuries in brain trauma has to do with called diffuse axonal injury. Now, diffuse axonal injury is common in soccer, for example, in the process of passing. In American football, it would be associated with head-to-head trauma. Now, this impact affects the frontal aspect of the brain and the occipital aspect of the brain, disrupt CB1 and CB2 receptors throughout the entire cerebellum. Now, the endocannabinoid system triggers a response, which the immune system governs that particular response. So what we have is a array of white blood cells that respond to the area of injury, which unfortunately can cause an increase in damage to the brain. Now, diffuse axonal injury is very critical to remember because it is associated with CTE, which is a form of debilitating brain trauma leading to dementia and inevitably death. We are seeing it repetitively in American football players. Indeed, 91% of American players in college have sustained enough damage to develop CTE. The studies in soccer worldwide reflect similar statistics and is associated with certain actions within sport. Now, addressing issues in soccer and football as examples, but certainly this can occur at automobile accidents where the head is impacting any aspect of the automobile, or in common falls. Certainly the elderly are at risk for fall. Certainly individuals who work in construction and high danger zones are at high risk for fall. The impact to the brain, where the impact is reflected to the back of the brain, is something that causes traumatic encephalopathic changes, leading inevitably to death. It is a really horrific way of encountering demise. Next slide, please. On the one side that says uninjured and the other side that says concussion, you will see a complete change in impact in the concussive. Now, the brain swells, it responds by producing massive areas of immune response, which causes blood vessels to constrict. The patient suffers symptoms, ache, nausea, vomiting, loss of consciousness. Concussion is mild or quite severe. Now, that differs from the diffuse axonal injury in that a concussive injury by itself may be very simply endured by encountering an inanimate object with the front of your head. Unfortunately, we know that concussive injury can cause a vast array of symptomatology, which can be very debilitating. It's also associated with the progression to CTE. So anyone in their lifetime who has endured several of these even mild concussions is placed at a great risk for developing dementia, cognitive issues, neurologic problems that may manifest as far as movement disorders. And so concussive injury is something we want to be very aware of as we're thinking about how we're going to both prevent it using cannabinoids and treat the debilitating effects post-injury. Next slide, please. Coup contra coup injuries are encountered when, again, the individual impacts a player on the field, the head goes back and then forward. These coup contra coup injuries result in a global effect in the brain, leading to progressive chronic traumatic encephalopathic changes. Now, one thing we know about cannabinoids and why we're looking at them, and indeed the athletic associations throughout the world have taken them off of the list of banned substances, with the exception of the United States. What's important is that the anti-inflammatory processes that are associated with cannabinoids can be beneficial in reducing these types of inflammatory processes, and especially among athletes going to endure them as part of their profession. So using a low dose of cannabinoids, for example, may be beneficial proactively for soccer players, football players, boxers, individuals who are skiing and like extreme sports, people who are high risk for falls, to keep the anti-inflammatory effect in process. Remember, phytocannabinoids do not mask symptoms. They replace the dead that is occurring as a result of the axonal injury in the brain. Very different process. Whereas we use opioids to manage pain, they dampen symptomatology. They do not help the body heal or rejuvenate the endocannabinoid system. And that's what we are aiming for in this entire array of sports management. Next slide, please. This is chronic encephalopathy. On the left side, we see a slice of cerebral tissue that would be relatively healthy. On the right is something quite different. Someone who has endured either mild concussion or severe concussions, diffuse axonal injury, coup contra coup injuries are at high risk for developing CTE. And CTE can progress quite rapidly once it reaches a particular threshold. Key there is understanding the symptoms of losing cognition, losing balance, inability to swallow, respiratory changes. All of these may accompany CTE. The argument is to use the cannabinoids that are available to us to help prevent these massive inflammatory processes so that athletes can, one, become more active right after enduring a type of a head injury, after the respite that's required, and two, not progress into CTE later on in life. It's becoming a commonplace occurrence among retired professional athletes. Next slide, please. Cannabidiol, CBD. In our country, it's produced from industrial hemp. We have quality assurances that are used in labs that authorize the level of THC that is 0.3%. As a chemical, it has an enormous potential to replace and certainly can be used adjunctively in pain management. So instead of going down the path of narcotics and extreme opioids, one, using CBD oil preventatively, and then in acute situations where pain management is absolutely essential, using it adjunctively. We know, for example, that using cannabinoids in combination with the lesser of the opioids, which would be, for example, tramadol, perhaps Tylenol with codeine, we know that we can use that adjunctively in reducing both pain and inflammatory processes. So the role of CBD oil, which is known for thousands and thousands of years in the world, is especially important as we face an opioid crisis throughout the world. Now, I will bring to the table one of the things that is occurring in individuals who have head trauma is that a progressive systemic effect occurs. So you have a combination of changes in your joints, changes in your mental function, producing anxiety, loss of cognitive function, severe headaches, and the anti-inflammatory process that is systemic when either using this as an inhalant or using it ingested as an ingested substance can be enormously beneficial. Again, using it preventatively and then post-injury. Now, the qualifier is that CBD does increase the effectiveness of blood thinners. Someone who is on Coumadin, a blood thinner, would not be it would not negate using as much CBD. You start low as far as dosing, and then you can intolerance of the individual. The side effects are minimal. It would be ideal to, because the taste is not necessarily ideal, to use it with lipids, fats, peanut butter, some type of a fat, so the increased absorption. But cannabidiol is a wonderful augmentation into managing pain and inflammatory processes in our athletes. Next slide, please. We know, for example, that progressive injury leads to debilitation. We know that sports that are at high risk for head injury lead to CTE. It is a natural assumption that we would start looking to natural substances for people who are in great physiological shape, but maybe at high risk for head injury. The key point, phytocannabinoids are naturally occurring. They replace and they do not mask what is going on physiologically in the human body. So, for example, using cannabinoids, CBD, on a daily basis as part of an inflammatory process is recommended for anyone who would be in a situation where they would be at high risk for brain injury, for arthritic changes, for orthopedic injuries, for pain, their normal daily routine. And then certainly in acute treatment after injury, we can use CBD adjunctively in managing pain and inflammatory processes, and then chronically after recovery and rehabilitation to get people off of the acute need for opioids. I am not saying that opioids are not important in acute situations where pain is absolutely horrific, but it should be short-lived. We have too many professionals who wind up addicted, and college athletes who wind up addicted to opioids. It's simply not necessary. It should be short-term. Next slide, please. This particular presentation addresses cannabinoid cytokines. Cytokines may be viewed as being a massive byproduct of an immune system response, and of pertinence is the pandemic in which we are addressing COVID-19 worldwide. We know, for example, that the cytokine response, called cytokine storm, is what is leading to adult respiratory distress syndrome, and then in individuals who survive COVID, the long-term effects. So I'd like to discuss cytokine activity, immunological function within the human body, and the use of cannabinoids to mitigate cytokine storm as we face such virulence as COVID-19. Next slide, please. The immune system responds to the invasion of a virus. And in this case, we'll use COVID as an example. The coronavirus specifically attacks lymphocytes, entering the cell, identifying that the human cell can serve as a host. Now, viruses are not something that live without a host. We have to be a host to them. The response is a massive immunological occurrence called cytokine storm. So you're exposed to coronavirus. In a healthy immune system or an unhealthy immune system, the response is mild or severe. We don't know the factors that are mitigating this, but we do know that what we want to avoid is cytokine storm. We know that the immune system can trigger a massive response to the oropharynx, which causes pneumonia and respiratory failure. That is what is occurring in coronavirus. Now, for whatever reason, our immune systems are unable to mitigate the cytokines. These cytokines produce respiratory failure, severe headache, gastrointestinal distress, cognition, debilitating ocular issues, and they persist even after the individual survives. Next screen, please. In the endocannabinoid system, phytocannabinoids suppress cytokine responses. The goal here would be to use phytocannabinoids on a daily basis to reduce the inclination for the immune system to basically become haywire given the invasion of a virus such as COVID. I am not saying that cannabinoids will stop cytokine storm. That's not the goal, but we're trying to reduce the horrific response that we have, causing people to go into respiratory distress syndrome. Now, we know that endocannabinoids can be ingested, they can be inhaled, and this particular colonization that is occurring in the back of the oropharynx is something that is an area for research and perhaps an area in which we can use endocannabinoid benefits by providing cannabidiol into the oropharynx, whether that's in ingestion, it could be used as a syrup. The idea is that once it enters your lungs, cytokines are massively produced in some individuals for whatever reason. It could be the presence of diabetes, it could be some cardiovascular disease, but now we are seeing it occurring in healthy 20 to 50-year-olds, and indeed that is what is causing COVID pneumonia. The benefit of cannabidiol, again, anti-inflammatory, antipyretic, it mitigates the issues of clotting. That's important because one of the things that we do see in COVID, as well as other viral infections, are small microvascular changes. The endothelium is literally attacked by the virus, causing strange clotting patterns, which can lead to pulmonary embolism, and inevitably that can cause death. So the thought would be that we use cannabinoids in preventing the inflammatory process and perhaps enhancing the benefit of reducing microvascular clotting, which is causing embolism in patients infected with high viral loads. Next slide, please. This slide shows the massive system which occurs in the immunological response to an antigen such as COVID-19. It's quite complex, and the mast cells will attack systemically lungs, kidney, brain, bowel simultaneously. These virons are minuscule. What we don't want is the human body to produce massive amounts of immunological responses, causing the release of these toxic products called cytokines. Cytokines cause the body to go into shock. So on a daily basis, thought would be that keeping the endocannabinoid system in play, keeping it healthy by providing some type of a substance such as cannabidiol, whether it's ingested as a capsule and inhaled, to keep the cytokine storm at bay. So in the event that you are posed with a viral infection, we have some type of a response that is not massive, but may not be deadly. In the time where we are trying to vaccinate the world against variants and strains, we need also as an undercurrent strong physiological support, and that would be obviously multivitamins and a vitamin D and certainly cannabidiol. Cannabidiol is incredibly beneficial on a daily basis, and I think it should be incorporated as part of our human experience as we face these types of respiratory challenges. Slide, please. The endocannabinoid response can be enhanced by the dosing of cannabidiol. Women require less because of our density of fat as opposed to men. But again, tweaking the dose, augmenting the dose so that it is therapeutic for the patient and enhances the benefit is ideal. The goal is to watch the immune functions, easy to measure the immune function, and cytokines can be measured, interleukin can be measured, responses to virons can be measured. And what we want to see is that the human body is not producing a massive inflammatory response to any type of an invader. Now, given that this pandemic is so aggressive, we don't have a great deal of time to produce that type of research. So the goal would introduce cannabinoids as part of the diet, as part of a daily process of supplementation to keep the population from experiencing an extreme response to viral invasions such as coronavirus. It is one facet that is certainly warranting examination at this point. Next slide, please. Once you calm the immune system down, the natural host will combat the areas that are being faced with viral invasion. So instead of a massive response of cytokines, which shuts the entire system down, if you can mitigate that response, then our immune system will naturally go to those areas which are experiencing high levels of viral production. It may be the lungs, it may be the brain, it may be the kidneys, but it gives you a chance to recover. It should be a supplementation, viewing it as if we are going to war, and it is simply a matter of enhancing the physical attributes. And that's something that we need to do as a populace at this point in time to be our strongest, whether it's among young adults who are at great risk right now for coronavirus, or our elderly. And it's so easy to enhance the diet with CBD. And the side effects of cannabidiol, meaning that it has not the most ideal taste, is simply easy to address by mixing it with another type of a food, whether it be a pudding or a peanut butter. And other than that, adding that routinely to individuals' diets, I think would be worthy of examination. There are certain high levels of cannabidiol in various diets throughout the world. I'm not as familiar with the diets of Brazil, but I certainly am familiar with the diets in Israel. We know that it's very important in reducing inflammatory processes, and those types of foods that we would have to eat in large quantities, such as mangoes, enormous quantities, can very easily be supplemented with a simple cannabis oil. Next slide, please. As I have said before, these types of illicit responses also apply to various types of viruses. Interestingly enough, a lot of us experience post-influenza syndrome. We experience post-polio syndrome. We experience viruses which cause such things as hepatitis. All of these types of viruses have the potential to systematically invade our bodies and cause physiological distress. Again, the augmentation of cannabidiol into various forms, which can be intrinsically added to your diet, might reduce the fact that we have people with diabetes and heart disease, for example, who produce these types of massive immunological responses to secondary infections, such as coronavirus, such as influenza. So the underlying issue of endocannabinoid deficiency can be mitigated by using cannabidiol. And then when a second challenge or two comes forward, the response will not be so horrific. In combination with vaccine, this may present an excellent possibility for us worldwide. Next slide, please. In summation, the use of cannabidiol in various virulent pandemics, bacterial pandemics, again, to enhance our basic physiological function, is something that we have documented research through decades. We know the anti-inflammatory effects. We know the antipyretic, the anticoagulant effects. They're very well documented. We simply have to implement. It's not incredibly costly to do a dietary change and add cannabidiol into the population, but it's certainly warranted because we do not have the attributes right now to combat facing us. And so nutrition becomes imperative, and any type of supplementation that has documented therapeutic effects like cannabidiol to enhance endocannabinoid. Next slide. The endocannabinoid system is something that it is very, very important in childhood disease as well. In children, while they may not develop COVID as rampantly as adults, we know that they do carry it. Now, the question has always been the use of pediatric cannabidiol. Again, using it in small doses for children above the age of 12, for example, would be beneficial. The immune systems of children are quite different and flexible. As we grow older, that completely changes. And we are exposed to stimulus, which produces a kind of an aberrant response. But one thing we don't want to occur is we don't want to have inflammatory processes among our pediatric population, which render them debilitated before they have a chance at life. And so again, the question has always been, can my child have a cannabidiol gummy bear? Well, certainly. But again, the dosage is important, where we're looking at, the amounts of 20 to 200 milligrams in an adult. We're looking at 1 to 2 milligrams in a pediatric patient. But again, the thought that perhaps a powder, that perhaps a syrup, incorporate on a daily basis into a familial environment as part of our dietary changes, anything at this point to enhance our likelihood that we will survive these types of onslaughts without a immune response that produces cytokine damage. Next slide. Thank you very much. I really appreciate your time.
Yeah, let's go to the Q&A. Jaime, do you have a question?
Yes, I do. As you said, let's start with the post-traumatic brain injury. I understand from your explanation that CBD does not have a very clear in terms of the ligands with CB1 and CB2, but you also say that the CBD has a very important action effect on post-traumatic injury. How it works in the brain, because if it's not a ligand with CB1 and CB2, how it acts?
It's anatomide. The binding occurs between the ingestion of cannabidiol enhances your anatomy, and also as a byproduct increases your nitric oxide levels. Anatomide then binds to CB1 and CB2 receptors. So it's an indirect approach as opposed to a direct approach with THC, which we see in cannabis. And the issues with cannabis being psychoactive, again, that can be moderated with CBD. But by increasing anatomide levels, then we produce anti-inflammatory response. There are increased anatomide levels that are not associated with the use of CBD, and that would be anything that's dark, black tea, dark raisins, dark currants. The issue there becomes the amount that you're going to have to eat. Raisins you can eat, but I have a limit. So cannabidiol increases anatomide, enhances the picture CB1 and CB2 receptors as being catcher's mitts in baseball, and we require cannabinoids to stick into those mitts to provide intrinsic responses in the brain. Now, without those cannabinoids, those receptors change and they begin to catch other things. So if we increase phytocannabinoids, which are a natural replacement from the hemp plant, then it allows normal function. So those are replacements in the suppression of inflammatory process instead of masking. So you're actually replacing what becomes damaged as a result of brain injury or various other processes.
I see. Thank you. And just another question, Marcus, before you ask. Do you see any role that THC could play in those cases of brain injury associated with CBD?
Absolutely, because and again, THC is absolutely critical. Cannabis is critical. It's how it is regulated in each country. But THC can be used to reduce anxiety and depression associated with brain injury. We know that THC by itself has an anti-inflammatory response. A ratio of 1-to-1 of having THC to CBD is ideal in brain injury, for example. But you're going to need you're going to need a higher ratio of THC to CBD. But as you can see, you can have a patient, for example, who is severely depressed but has severe orthopedic problems from, let's say, playing soccer. So he has an issue of pain and depression. So using THC to enhance the anti-inflammatory effects of CBD and providing the antidepressive effects would be an ideal combination. And the blood-brain barrier is more rapid, obviously, with inhalation than it is with ingestion. We have a 2-hour lag time, and sometimes that leads to some complications. You have to watch how much you ingest because it doesn't readily boost. Now, it has a cumulative effect, so we want to make sure that there's a regimented compliant program in treatment, whether it's cannabis or cannabidiol.
Dr. Michele, it was two great presentations, two different subjects. So I would like to start for your first presentation. We were talking about sports and concussion. Here in Brazil, we have a very famous boxer. He's called Maguila, and he was the first Brazilian heavyweight champion of the world. He's already very old, and he suffers from the boxer dementia caused by concussion. So recently he started using cannabidiol and recovered much of his cognitive functions. He recorded a very emotional video that became viral here in Brazil. So I asked, how is this possible? Is it possible for him to go back to what he was before?
And he has chronic traumatic encephalopathy. Yeah. So again, using cannabinoids and cannabis, so you address, often with diffuse axonal injury, you get anxiety because people get confused and they get severe headaches, and that adds to agitation. If you, again, understanding the various strains that we have available for cannabis, that we can change the terpenes and the flavonoids in the cannabis plant. It's amazing the science that is going on. So you want to reduce the agitation. Now THC, certain strains will produce increased activity. And I'm sure, having been repeatedly, hit in the head, there's ongoing inflammation which causes pain. People, respond poorly to that. So the combination of using, a cannabis strain that allows mental clarity and reducing the agitating factors in his environment, increasing cannabidiol so he doesn't have recurring pain. Treat the pain. I mean, a lot of times people are agitated because they're in pain. And then add something that helps you makes you feel better. We know that cannabis increases your feelings of elation, feelings of functionality, but you don't have to be so delusional with certain things. It doesn't need to be a very, very high THC level, but more in this kind of a situation of a 2-to-1, because THC enhances the anti-inflammatory effects of cannabidiol, because cannabidiol indirectly increases anandamide and receptors. THC binds directly to the receptors, but straight THC has its own delusional psychoactive effects. So that's why we kind of mix and match with a cannabidiol and cannabis mixture.
Great. Just another question, Jen. Let me do two questions like you. I would like to talk about the THC.
There you go. Yeah.
Some sportive associations are allowing the THC, like the UFC or the Baseball National League, but the THC is still banned by the WADA, the World Anti-Doping Agency. So what do you think about this banning?
For professional athletes in our country?
Yes.
Are you talking about athletes in our country, in the United States? A lot of our players. No,
the WADA is around the world.
Around the world, cannabidiol is routine, except for the United States for some reason. But now we're swinging. We have a different administration here, right? We're swinging away. So cannabidiol is, I can honestly tell you that every professional athlete that I've encountered who plays football or soccer, even off the field, uses cannabis or cannabidiol routinely, because you cannot function and it has a long effect. So, a significant amount of CBD in your system is going to be present, hours later. You may not be able to take it on the field. You can take it with your pregame meal. You can take it with your postgame meal. And THC, when the players are not, on the field, is again used routinely for players for a couple of reasons. Imagine being hit in the head 10, 20 times in a game. Imagine headbutting that often in a soccer game. I cannot fathom what your brain feels like. You're going to be depressed. You have the elation of the epinephrine going on from playing competitively, depression that occurs once you actually stop playing. And so THC is used to replace those damaged cannabinoids. Once you get hit in the head, your blood vessels and your immune system respond. Everybody goes to the party. Unfortunately, nobody is bringing anything to wear. And so you have to replace those. And we use them with phytocannabinoids.
All right. We have a question here from Dr. Flávio Formigione de Freitas. He's a sports doctor. He works with high-performance athletes. Let's listen to him.
My name is Flávio Formigione. I'm a sports doctor. I prescribe CBD, and I would like to know if it is advisable to use as a prevention strategy CBD for all the athletes that are prone to head injuries, like martial arts or American football, or even soccer, skateboarding, and other sports like that.
Yes, okay. The research has been conducted at the University of San Francisco, Israel. I have an entire library which is available. We operate an educational, professional education. It's called a Cannabis Academy, and we provide CEUs and CMEs for physicians and practitioners on cannabinoids and the use in various facets of physiology. So the library that we have used from professional journals worldwide it's quite interesting because remember that while we're looking over here at facets to control inflammatory processes in athletes, the research for people who are actually in the lab supports that cannabidiol has documented anti-inflammatory effects. THC, well documented for depression. Research is there. It has been done worldwide, and it's been done for decades. And now that availability, if you email me, I'll be able to send you some information on both our courses that are available for you to peruse. The massive library that's available. I spent years doing this because what's very frustrating is to be able to speak on cannabinoids and the cannabinoid system and not be able to cite studies. Well, the research is there, and it's well presented in peer-reviewed literature from all over the world. So in our athletes, the argument is that physicians, sports medicine practitioners who are training our athletes, or are watching them in the field, knowing how to use cannabis and cannabidiol prophylactically, and then and chronic and traumatic injury can prevent us from leading down the path of opioids in these athletes. Especially, I'm very concerned about leading it to CTE, which, as you described with your boxer, that's a recurring problem. And we have young men and women in their 40s who play soccer and completely incapacitated because of the frontal lobe damage. So yes, the answer is yes to the research. My email is gasbear@aol.com, gasbear@aol.com. Drop me a line, and I'll send you some information. Any questions at all? But again, this is not really new information. It's just something that I think our pharmaceuticals is kind of steered away from addressing what is actually available for us.
Perfeito, a conversa foi ótima, mais uma conversa ótima aqui. Agradeço muito Jaime Ozzi pela presença, Marcos Bruno também, e a doutora Michele, que esteve aqui conosco e trouxe muitas informações super úteis para nós. Bom, a gente volta a qualquer momento com mais uma live aqui para vocês. Até a próxima.